We of course picked the day that it is balmy outside and everyone is home barbecuing, walking the dog and enjoying the wonderful evening. So I understand it's going to snow tomorrow, so we'll get back on track. So my name is Deborah Weymouth, and I fortunately serve as president and CEO of HealthAlliance Clinton Hospital. And I wanted to just kind of walk through what our plan is for the evening, and then we'll go ahead and get started because we actually have work we need to do to complete before the end of this evening. So again, thank you for coming. Your honest feedback, views, perceptions, comments are very important and needed at this particular meeting. So as we stated before, what we're going to do tonight, the meat of our meeting, is to share with you a draft survey that we kind of put together, thinking it might serve as a model or a straw man, if you will, that we will eventually be sending out to the entire Clinton community. So it will be in the newspaper, it will be able to be accessed online, and we're really interested in the community providing us feedback on this particular survey. So we need your input to be sure that we have captured everything we want to ask about. Because if it's not on there, when we go to ask, obviously people may not think about it. So our goal tonight is to do some brainstorming, which is why the posters are around the room. And I will give you some more specific details on that as the evening goes on. Couple of ground rule things. I wanted to let you know that the Sterling-Lancaster public TV folks are here. When we actually split up into groups and get talking and brainstorming, they will pack up and leave, so that I didn't want anybody to feel like, you know, you were on TV while you were trying to brainstorm, and that might be a problem. So we didn't want to inhibit any of that conversation. So they're going to be here for the beginning, and then they will be leaving us at that point. So we've got some data and some information for you. So I wanted to walk through what happens with this survey after we get it all done and out to the community. We then are going to bring together that group that we had talked with about that advisory group of volunteers. Right now, I think we're up to probably 20, 25 people who have volunteered to be on that group. They are actually going to sit with us and go through the results of the survey. We'll get to see, you know, how many people prioritized each item, what they specifically said. And then we'll hopefully be able to identify a service or two, as I said last night, that we will be able to launch and bring to the Clinton community, hopefully sometime in this calendar year. All right, so that's our goal. And establish a plan that will allow us to continue to grow as we go into the future. So your input is vital into that. Okay, so we're designing the survey. The survey is going to go out, canvas to the entire community. We're going to collate all of those answers together with the advisory group and then come up with a launch plan. All right, questions on that? Sir?
What designates the community? Where? How big is the area?
Well, I was actually going to put the survey itself in the item. So I figured anybody who is in that catchment area that reads the item is probably served by Clinton Hospital. We know from our background work that there's kind of 4 primary communities that Clinton Hospital serves. So we would try to publicize it and get it out to those areas, Sterling being one of them. Okay, good question. Yes?
I have another question.
Sure.
Not a question or comment. The daily item.
Yeah.
And computer accessibility in the town of Clinton, that probably won't reach out, not most of the town, but in the surrounding areas.
Okay.
People don't have access to computers, and there are a lot of people that don't spend the money on the item.
So how else can we get it out there? Mail. Okay, so we'll just do a blanket mail then to everybody? So, and then have them mail it back? Best thing, or drop it off at the hospital? Okay, Great, thank you for that. We'll do that. Other thoughts? Good. Okay, so everybody kind of understands the process going forward. Now that he's back, I did want to call out Representative Naughton is here with us as an elected official this evening. He was there obviously last night too. I don't think there's any other elected folks here in the audience, so thank you very much for coming. We appreciate it. Ongoing input. Did I miss anyone else? Okay. So that's where we are on process. But before we get started, I want to give you a little background. So we have, for your reading pleasure, a document that we have put together, which is basically a summary of the highlights of the community health assessment that was done a couple of years ago. And this document will be available on the website of that little orange card that was on your seat. So if you would like to go look up, the entirety of the document is 127 pages long, I believe. So you can look it up and read all the way through. But hospitals around the state actually do one of these assessments, if you will, every couple of years. And then from that, they take programs and services that the community needs, that they have identified, that we can put into practice to improve the health of the community. So that's where this basically came from. So I needed to just go through it at a high level so we could kind of level set on some demographics and some information about this particular community that Clinton Hospital has served over the years, so that we're prepared for our brainstorming. So really this involves the integration of what the hospital can provide, what the community in fact may already have, and then also the needs, the unmet needs of the community coming together around, as you can see on the front page, the community improvement, the health improvement plan. So this takes place over a process where we actually try to gather information and pull it together to organize it in a fashion that we can then address as healthcare providers. One of those pieces that is increasingly focused on in hospitals is called the social determinants of health. And these are things that, although may not be directly related to healthcare, that you can go into a doctor's office or a hospital to obtain, they're clear drivers of health status. These are things like access to healthy food and housing. Transportation somewhat can also be there. And these are increasingly important factors that fortunately, the world of healthcare is now identifying, really driving someone's ability to live a long and vibrant life. There have been numerous studies done around the country where literally two communities within very close driving distance, and I'm saying 3 to 5 miles, have a difference in the length of life of up to 20 years by the residents in the two communities, only because of these social determinants of health. That could be, again, as I said, access to quality food. They're commonly called food deserts when there is not food around, and housing issues and other related concerns. So we also want to keep some of those in mind because obviously that impacts the health status. The other piece that's important is that health isn't just about a person, although much of our own individual choices do drive our health status. How many burgers we eat, how many beers that we choose to drink will eventually catch us at some point in terms of our health status. But it gets bigger than that. And you can clearly see on the social model that's in the packet that it's not only individual factors, but interpersonal factors like your own support system, decisions that your family makes, organizational factors such as your school, other community events, or other community organizations that can support health, and then eventually up to policies and systems that are driven to us by government that also impact the health status overall of where the community's headed. So those are kind of the layers that we also want to be sure that we're aware of. So the last time we did this survey, there's a segment in this packet that talks about the biggest health problems in the community, and this is in North Central Mass. And these are the top 5 things that were identified. Number 1 was substance use and lack of treatment resources. Number 2, mental health, inadequate treatment resources. Number 3, obesity, unhealthy eating, barriers to eating, such as cost or availability of food. Number 4 was transportation. And number 5 was the overall cost of healthcare, things like co-pays and insurance limits. Certainly high deductible plans have played into that, where now people have to come out of pocket for a high deductible payment that would be impacting another health issue. So as you look down this list, there are many of those social determinants that I referenced earlier that do appear on this list in terms of impacting health. They are things like unemployment and poverty, homelessness, not obviously something you're going to get directly from your doctor's office, but clearly impact health status. So if we go through yes, go ahead.
Could you tell us what the towns are that comprise North Central Massachusetts, and also how old is this data?
So this is the last time we did this survey, which was 15-16. And it is, the full document is, as I said, on that orange card that I gave you on your seat. And there's a map of the specific towns, but all of the ones that Clinton covers are clearly in there.
A lot more?
Not a lot more, but several, yeah. It's North Central Mass, it's the region, yeah. Yes, sir?
I give to the United Way in North Central Mass encompasses a huge area.
Right.
Not just this community.
Right.
So 0 to 80, what is that? Percent? Is that per thousand?
So these are responses from the 479 people that responded. Those are actually hard numbers of people who said. So approximately 77 people said substance abuse was their number 1 concern. So that would be how to read that.
So that's an actual number, not a percent.
Correct. Okay. All right, so let's just quickly go through the demographics. And again, I'm referencing the community health assessment on each one of these pages, so you can look it up. But I want to just call out a couple of things. As was said last night, under the demographics, there is an older population, especially in Clinton, than there is in the rest of the state in general. We have lower incomes in this particular area, and many individuals and families struggling with poverty and unemployment, and potentially lower levels of educational attainment. Also want to note that indicators of mental health issues are among the highest in the state. Obviously, that is why the individuals on that first graph pointed out those 2 needs of substance abuse and mental health support. Psychiatric hospitalization rate for depression, prevalence, and suicide rates are higher than in most of the state. And there is a higher percentage of smokers across all age groups than the state, especially among adult women. Heroin, obviously, is a primary substance abuse, and its use has continued to increase. Under the maternal child health issues, I want to call out there's lower rates of adequate prenatal care and higher rates of infant mortality than the state, and nearly double the rate of women smoked during pregnancy than in the rest of the state. Coronary heart disease and cerebral vascular disease, which would be like a stroke, are significantly higher in this particular area. And interestingly enough, adults across age groups are more overweight in the area, especially between the ages of 45 and 74. High blood pressure and high cholesterol are higher in most groups than in the state, and adult women report higher rates of disability than men. Finally, motor vehicle accidents clearly is an issue in this region. It was reported when this study was done that the rates were 10 times higher in the particular study area looked at. And there were significantly higher rates of child maltreatment than in some other parts of the state. So this gives us just some background. And again, the full report is available on the link in the orange card. Okay? So our task tonight is to think about services, programs, support groups, things that we, as you, as the community, feel you need and would fully utilize in your local hospital. What we're actually going to do is we're going to split into 4 groups. We're going to have some of our organizational leaders lead us through the conversation. One of the leaders will be writing your ideas. The other one will be talking to you about brainstorming. We'll give you a few minutes to brainstorm. Hopefully we can fill up all of these sheets. At that point, we're just going to transition into having your group come to consensus on the top 3 things that are the most important to you. So come up with the top 3. And then what we'll do, as I said before, is take those back to the advisory focus group, show them what that you came up with, and see what else we need to add to or append to the survey before we get it out to the community. So this is anything that you think would help health status of your friends, your neighbors, your grandmother, your children, anything that you believe should be delivered in the community that you really feel not only you, but your group could get behind in terms of a service, okay? And we'll add that on to the survey. So questions about that process? So again, our goal would be we leave each one of the charts with our top 3 at the end of our time. Yes?
Can this also include like adding primary care physicians?
Absolutely, absolutely, which I hope will be on there in a big way. Yep, yep. Really anything. So again, think through support groups, education, other care that you need. Perhaps in chatting with someone, you've heard them say, gee, I really wish there was a fill in the blank. Cardiologist, pulmonologist, gee, I wish we had cardiac rehab in town. Whatever it happens to be, let's jot those down and capture them on the list. All right? Yes, ma'am.
I'm not clear how you're going to set up these 4 groups. How do I know what group I should be going to?
You're going to turn that way. That's all you got to do.
Oh, okay.
Yep. So if we're all set, and are there any other questions? Yes.
I'm so comfortable doing this because I don't think we have the right data to make those judgment calls. I mean, this study is based on a very wide area, including Fitchburg, Gardner, and Athol.
Right.
These are not communities that are representative of the communities that are serviced by Clinton Hospital.
And that is perfectly why you're here tonight, because you do know Clinton Hospital, and as a person who works in the hospital, you know it even better.
I don't
So.
know the hospital, but I don't feel like taking a wild guess as to what my neighbors really need. What I really like is better data. And that data, I think, is available through UMass Memorial. And I think we should be able to get that and get it analyzed. So that we have real information about
Okay.
really what our community is doing
Right.
in terms of what services they're using in the UMass Memorial system.
Right, and when we come together with the advisory group that I believe you're on, we will have a chance to look at all of that. So this particular meeting tonight is about getting the view of the community and what they see we need. We will then have a chance to look through the data. I have all the utilization data by service, where it goes, who does it, how many were done at Clinton Hospital. So we'll look at all that. And then we will put that together, and I'm counting on that group, that advisory group, to be able to help distill all that data down into a logical survey that will then not only add what people feel they need, but also combine it with the data and the business component of it, which we need to also add. Okay? Yes, sir.
Fitchburg, Gardner, and Athol, are people from there notified of this meeting so that they could come to it? Because if you're looking for input on what's going to make Clinton Hospital better, are they going to come from Fitchburg, Gardner, and Athol to come here for it?
No, I didn't notify them because this is actually about, this is a follow-up to the issues currently that we've been in discussions about in respect to Clinton Hospital. So what we are seeking to do is to find services that you need and that you want and that you will utilize at Clinton so that we can continue to make Clinton Hospital more vibrant. Yes?
How important is it for us to put services that are currently available at Clinton Hospital as opposed to other things? In other words, physical therapy, for instance.
Right.
You know, if we don't put something like that down, is that going to, they say, okay, well, we don't need that, we need this.
So
Understand
nope,
what I'm saying?
I do understand. So the fact sheet that was also on your seat has a list of the current services. So we are going into this discussion under the assumption that we're not changing current services, that we're adding to, we're augmenting that particular menu. Okay? Do you have another question?
Well, I understand that, and I'm happy with that. I guess my other problem is that the GI department was added not all that long ago.
Right,
Which obviously people thought that they needed.
right.
Somebody thought they needed.
Somebody thought they did.
A great deal of money was spent on that equipment, I'm sure.
Right?
How much, I have no idea. And it didn't last very long. So I think that, you know, when we say, okay, we need this, you have to know what the cost.
Right? And that was the third leg of the stool I just said. So when this advisory group gets together, we'll have this data, we'll have the utilization data, or the usage data, and then we'll also have input on the cost, the revenue, and the potential size of the overall market. Because that's the other thing that it tells us is on the actual market data, we can tell exactly how many people have heart attacks from the Clinton market, just kind of over time. So you know what those numbers are, and then we can obviously incorporate those things in. So all three of those legs of the stool would be added when the advisory board group meets. Sir?
You said last night that the last 3 years, there was $1 million shortfall in budget.
Yes, sir.
This fiscal year, you're already down, what was it, 500,000?
No, it was $5 million.
5 million. So what's the, is it, when you close that department, are you level funded now? Do you save $5 million? Did that department cost $5 million to run?
So the piece to that people really didn't get last night, and I own that, I didn't explain it very well. Both entities prior to the merger are 100% owned by UMass Memorial Healthcare. So by coming together and having one P&L, even if we save $1 by combining, UMass Memorial Healthcare is better off. So by, as I stated last night, instead of having 2 HR departments, we combined and we now have 1. So we've been able to reduce some of those expenditures on back office things. So by even reducing that loss, we are in a better position. I also wanted to underscore the point, and I tried to make this last night, was that the commitment to the organization, even though it's making money, is clearly there. You know, we're here. As I stated, we've put $2 million in the building since the merger. So the commitment is there. What we're attempting to do is obviously accommodate and consolidate back office functions that won't impact care in any way, but that will allow us to continue that delivery of quality care that you've become accustomed to. Hopefully that makes more sense than it did last night.
I still can't figure out what the cost saving was by closing the department.
It wasn't about cost savings. It was about not having providers to help us with that. But fortunately, we're not here tonight to talk about all of that because we've done that at least on 2 meetings now. We are going to look forward to what else we're going to do. Yes?
Well, I have 2 things. One, I'm going to ask everyone here participating in these groups to use this very cautiously. This is too broad to what really comes to our hospital.
Right, and I agree completely.
But I think that those who are going to participate need to almost tuck this aside.
Right.
And not use it to-
Great, we'll tuck it aside.
Take it what
Consider it tucked.
The next thing that I'm going to suggest too is we have to proceed with caution. And my feeling on it, and I didn't do a good job referring to last night too, to emphasize this, is the GI lab closing, us to move forward in a direction, we invest in equipment. We invest in opening two additional nurses to this unit for a reason. I lost one of the most amazing ER nurses to that department. Very skilled, great that she is, taking a job for Clinton, but I'm a little nervous. What we invest in that, we'll go, yeah, let's take it over here. I want to know that this is solid, a solid direction we're going, not just, because I felt like that GI lab was being built, and it was doing well to our understanding, and it was thriving, and from what I also understand is there was a doctor who was willing to stay there and do, on-call, but was told no, couldn't scope at Clinton.
So I would love to know who that physician is, because we talked to all of them, and that's not the case that we found. So the other piece to that is, in terms of us moving forward, and I agree with you on the data, if you don't want to use it, that's fine. I'm actually asking for your own experiential background of what people tell you they need, about, kind of where we need to expand services that people will genuinely use going forward. Believe it or not, to your other point, I have gotten the message that if we're changing something else, I'm going to talk to you first.
Thank you.
I got that. Call me slow on the uptake, but I clearly got that. So I know going forward, I'm going to give you probably 90 days on anything if we make any change, and we'll all talk about it. Okay?
Thank you.
No, I absolutely, I agree. Sure.
Thank you.
But we did, I got that message. Yes?
So I'm all about moving forward, and
Yep.
I agree with you, and I agree that I wouldn't put too much in this, tuck this away, but I would focus on the people that we heard from last night that are on the front line, the ER doctor and the inpatient doctor that spoke. They told us exactly what they need. They need
So
cardiology, they need GI.
Right, so let's capture whatever on the flip charts. But I don't want that to limit what other people in the room may need, because there's other support services and things that they may feel strongly about. I know I had a conversation with a woman who wanted a dietitian and access to a dietitian that she didn't feel she had. And that's an important piece to health. So I want us to be, when we're brainstorming, keep the opportunity open so that we can capture what all spectrum, the entire spectrum of folks might need. Okay? Yes, ma'am.
I know Clinton Hospital hasn't had a particular service ever, as far as I know, and I would like to bring up why Clinton Hospital itself doesn't have that service, because I would certainly appreciate it rather than having to go to Worcester. And I'd like to know in my group, can I bring up what that service I feel Clinton could use, given the population that we have?
Right.
And I just know a lot of people I talked to, they thought, yeah, we should
use that.
Yes.
So actually brainstorming, the good thing about brainstorming is there are no wrong answers. You can put anything up that you would like.
Okay.
The only word of caution I would have is things like transplants and open heart surgery. We'll never do those here. Okay. I just wanted to be sure. So, that obviously depends on volume and number of specialists. So, was there a question in the back? No? Okay. Sorry.
Another quick question. I know the Worcester VA clinic is sending patients over to UMass for a certain number of departments. And I remember hearing that when Clinton is sending patients to other places, there's going to be money involved that we might be reimbursed. Why can't the VA we've got tons of military people in this area.
Right.
Why cannot the military be sending some of their VA doctors here and patients. And that is one thing I thought, that's going to bring money to Clinton Hospital. We're talking federal money. I think that would be a good thing for Clinton Hospital.
So I have to tell you, I completely agree with you. 2 weeks ago, we signed a contract with the VA. I personally signed it. So VA, anyone getting VA benefits will be able to come to us in the future. I understand that, yes, you're right, it's federal money, but that they do hang on to it for a while. So we may have some delay in just getting paid, but I'm hopeful that they're good for it.
Yeah, yeah. Okay.
So that's a good thing.
Yeah, but
Yep.
that's what I'm saying. And I know rather than travel to the Worcester VA clinic, I'd rather be coming here.
Absolutely.
Yeah,
And we'd rather have you.
okay,
Yep. Okay.
yeah.
Other questions, comments? So we're going to open up our thinking about services that you, your family, your loved ones, whatever might need. So we're probably going to split this group right after Jan. So if you guys would face that way, we'll move that board over. We'll have you guys, let's start from this row over there. So if you guys want to move right there, we're going to face that board. That'd be easy. So this group is right up there at that poster board, and this group is right over there. So, thank you.